presentation.
Okay, now doctor, just walk us through what you're showing us here, please.
Sure. Giles, this is a different patient who actually is in need of removal of his teeth because of some unrestorable teeth and some issues with his periodontal status, and he's interested in getting some dental implants to support his new teeth. And so this is a cone beam CAT scan, and a cone beam CAT scan allows us to take a three-dimensional x-ray of his jaws and see where the problems are, and not only that, but to help us identify where the good bone is. For instance, we're focused in on this particular area here where his lateral incisor would be, and we can see the volume of bone. Based on that, I can do virtual surgery here to kind of place a virtual implant and to see if that implant will be sufficient, will it be too small, will it be too big, for additional bone grafting procedures necessary. And as you can see, for the case of discussion here, I'm placing one just for the sake of discussion, that this particular implant would fit fine in this area, and then we can actually physically see where that implant would be. And then we can plan out the rest of the cases. We can also study where in specific areas if sinuses are involved or if nerves are involved. So in this particular case, you can see the sinus begins here, and this is the nerve that runs behind the palate. It's the nerve that we all burn our palate when we eat hot pizza. It's the incisive canal, and certainly you have to be careful when you place an implant. But this is also a machine that gives us one-to-one accuracy, so there's no distortion or magnification in these images. So you can take a little measurement and you can know exactly in millimeters. This is 4.1 millimeters wide, and in this particular area this is probably about 14 millimeters or so, 10.7, and so that's the maximum amount of bone you have. It also gives us what's called Hounsfield units down in this corner. So if I put my cursor on an area of bone, that's about 300 Hounsfield. So it's not really the strongest and densest of bone, and so you have to think about that and what kind of technique you would use to condense that bone to get a stronger stability for the implant. So it is very critical, important information when you start looking at implant diagnostics. It can be also used for TMJ diagnostics to verify what's happening within the joint with three-dimensional imaging.
Tell us a little bit about TMJ and the special techniques and the way that you help people solve that problem.
My whole model of care is based on evidence-based. In other words, we take what the patient's chief complaints are and listen thoroughly. Once we understand those particular complaints, we try to look at their medical history and see what other influence could be causing us or helping that particular situation. Then we go through a formal diagnosis process to see, are the patient's symptoms matched up with specific tests that will correlate those two things to say, yes, there's conclusive proof that this would benefit from therapy, or no, we're wasting our time. Once we have that information, we'll generate a customized treatment plan for the patient in different stages to get them from point A to point B. Let me show you one quick example of patients that we have helped in this particular situation.
Yeah, I mean, we get a lot of patients, a lot of people who contact us saying they suffer from TMJ, so this is a very timely issue for us at the moment.
Correct. We've taken patients who have headaches of simple nature, and we'll talk about Jennifer, and Jennifer doesn't mind talking because she wants to share her story quite vividly, but she is a young lady who started developing headaches and wasn't able to open her jaw, and she'd wake up and be suffering from this particular headache pattern 24/7. And her range of motion, as we'll see in a moment, and this is an orthotic appliance of one type that we have made for her, but to help you understand Jennifer's quick results, we will close out of this.
So people suffering from headaches who might not understand that they have this resulting from TMJ.
Correct.
What other symptoms do people generally complain of?
They usually get headaches between 4 to 8 a.m. or 4 to 8 p.m. They're typically located in the temple areas, behind the orbits of the eyes, sometimes back in the neck in the area here. They get fatigue in the jaws, and so those are the classical signs of somebody who may have some TMJ problems and myofascial headaches. Sometimes they confuse them with migraine headaches as well. Those patients will be at higher risk of breaking teeth, getting gum disease issues, because the loads in their mouth won't be quite stable because the joints and muscles are not functioning at their peak harmony.
Okay. So when a person comes in for a consult, you work with this technology here and identify the problem and come up with a treatment plan.
That is correct.
Well, folks, if you're having any sort of those symptoms, please feel free to contact us at spacecoastmedicine.com, and we will forward you on to Dr. Patel. And Dr. Patel, thank you so much for sharing this incredible technology with us today. It's been very eye-opening for me, and I'm sure many of our viewers as well.
My pleasure.